I want to share with you a very simple blood test that has been shown to be associated with an increased likelihood of miscarriage and a reduced likelihood of live birth. This is a test that I find is not commonly checked for a lot of patients. I commonly see patients that have had some workups and assessments for recurrent pregnancy loss, and it is often missing. Occasionally we do see patients where it was checked by their healthcare provider, but I feel like it's a less known marker of potential issues that could be causing miscarriages. And if you've had recurrent pregnancy loss, you know better than anyone else that often there's a lack of guidance on where to go next, what could be potentially causing the issues for a very large portion of patients that are experiencing this unfortunate condition. And I find this test can help provide insight into what might actually be going on. And we never use it alone. It's always used in conjunction with other assessments, recommendations, and treatments. That being said, a simple blood test for something called C-reactive protein, or we use the short term CRP. It's a protein produced in the liver, and it goes up. It's known as an acute phase protein or reactive protein. Basically, it goes up in times of inflammation or infection. So why is this such an important test? Because now we're seeing observational studies that have associated with increased CRP levels in someone with almost a 37% increased likelihood of experiencing a miscarriage and a reduced likelihood of having a live birth, unfortunately. So it's a very simple blood test, and it doesn't tell us exactly what's going on, but it gives us a very good kind of zoom in on where to focus, what's causing that CRP to be elevated. Is there a chronic inflammatory condition, autoimmune condition? Is there an underlying infection that's affecting the patient? And we're seeing more studies on how things like urogenital tract infections, bacterial vaginosis, which 50% of the time is asymptomatic for patients, actually have a strong correlation with increased likelihood of miscarriage as well. So CRP is a simple blood test that basically gives us an insight into a group of potential causes of what might be contributing to the recurrent pregnancy loss. And again, it needs further assessment, but if you hit like a roadblock where nothing is coming back from the basic assessment and you're not really getting any information on where to go next, this could provide kind of just some momentum to keep going forward and further explore some possible risk factors there as well. Commonly we see this is very elevated in patients that have conditions like endometriosis, polycystic ovarian syndrome, inflammatory bowel disease, other chronic inflammatory conditions. And so in some of the newer studies, we're seeing kind of 2.4, 2.3 for the CRP blood test. That seems to be the threshold. So if it starts to go above that level, there's unfortunately that increased likelihood of miscarriage. So we look at, what is potentially causing the CRP to go high, and that enables us to help treat that underlying issue. And then we usually see that CRP level come back down. Sometimes that looks like helping to control inflammation from endometriosis, which can, in a number of cases, cause more systemic inflammation, or better controlling polycystic ovarian syndrome, which is also associated with increased inflammation, screening for other infections that might be present, and looking at other potential causes there as well for that elevated CRP. So again, it's not a standalone test that we should look at as the only cause of miscarriages, but it could prove to be a very valuable indicator and help give better information on what might be causing this issue for you. So if you are experiencing recurrent pregnancy loss, you don't have any really concrete answers on what's going on, this is an important test to discuss with your healthcare provider, your healthcare team, and evaluate if this would be something that they can run and test for you.